Hello listeners, welcome to Views on Health. After quite a while, we have with us on the program tonight Dr. Indunil Piyadigama, who is a senior lecturer at the Department of Obstetrics and Gynecology, Faculty of Medicine, University of Colombo. And Dr. Indunil Piyadigama is also an honorary consultant gynecologist at the De Zoiza Maternity Hospital in Colombo. Welcome back to SLBCNR Studios, Doctor.
Thank you.
And the topic we are going to discuss today on the program is endometriosis. Without any further ado, over to you, Doctor, to introduce the topic.
So, talking about endometriosis, why we thought that we need to talk about is that this is kind of a very common condition that a lot of the women will face. So if you really take, if you count in a room, if there's 10 women there, there'll be one with endometriosis. So that is how common it is. So in a way, endometriosis is kind of affects people in mainly two ways. One thing that people mostly know is that endometriosis causes severe period pains. So basically, a lot of women are debilitated because they are having severe pain where they can't actually get on with their day-to-day work when they're having the cycles. And some of them might even have pain throughout their, every day. That is one major sort of a category. And the other major category that we see is women who are coming with subfertility, that is unable to or inability to conceive after trying for a long period of time. So that is also one of the highest or the ways of presenting in people with endometriosis. Very rarely we find few people who come for a routine checkups or routine scans, and then where we find some what we called ovarian cysts, and then we go on to operate and find out that they have endometriosis. So that is basically the briefing on the topic. So basically, you might wonder what actually endometriosis is. Or should I try to talk about the pain furthermore, or then get on to the topic? What do you think, Fatima?
That's all right. Doctor, we'll concentrate on the pain. Now, when you say it causes severe period pain, does this happen at the very early stages of a girl reaching puberty?
That is one of the I think one of the very good opening questions, because as you all know, period pain is something very common. Most of the people will have some kind of pain when they're having a period. But what is unique about endometriosis is this pain is kind of very severe, where you are unable to get on with your daily routines. And also this pain sometimes kind of, we say, outlasts the periods. That means suppose somebody is having periods for 4 days, having pain just the first day may be quite normal. But if it continues beyond 4 days, or even if it starts before the day of the period, that is where the real problem comes. So that is one of the ways. And also, when you talk about this pain, it might start early in life, maybe when they are about 15, 16 years. But over time, it goes on, and then people tend not to really think too much about this. So therefore, if we take worldwide, average time from somebody starting getting pain to come to a diagnosis that they're having a disease, which we are talking about, endometriosis, will be somewhere around 10 years. So suppose now from 15 years somebody starts getting this kind of pain, by the time they're diagnosed, they are almost like 25 years. So it takes a long time for the diagnosis, because there's a bit of an overlap between the normal way and the abnormal kind of pain. Other than for this period pain, some of the women will have a pain throughout, in the sense you have some sort of pain during the periods, but even after periods and in between, also you have kind of back pain, pelvic or lower abdominal pain. You are unable to carry out your work easily. So that may be another way. Then there's another category where after they get married, they realize that they are really struggling to have a sexual relationship because it's very painful. So that is also maybe a indication that they may be having some sort of endometriosis within themselves. So some of them kind of in about 1% or even less than that, there may be involvement of the urinary tract. So that is the system that drains from the kidneys to the bladder, and it might get really blocked, and therefore kidneys might get swollen. So there may be silently all of a sudden going into what we call a hydronephrosis. That is the kidneys get swollen, there'll be pain on the back or the lumbar region, and the renal functions go down. So those are the kind of ways that the pain can present.
Dr. Bull, it's a natural thing when you have a pain. You take a headache, for example, you feel it coming, you take a paracetamol or something, a mild sort of a drug to ease the pain. Now, in this situation, is that advisable? Would you tell a patient you can take paracetamol or some other sort of painkiller that's quite mild, considering the situation, of course, the condition of the patient? Or would you prescribe something stronger to relieve the sense, patient from any
pain? Now, somebody having just period pain, if it responds to very simple things like paracetamol or what we call a non-steroidal anti-inflammatory drug, so that is the next line. If the pain responds to that, so that maybe it's just a kind of a normal or a physiological type of a pain. But people who are not responding to these simple medications, it's better that you have a consultation and have a look whether there's something advanced going on. Okay.
And then those who are subfertile, so you spoke of subfertility. How does that affect a woman, even she's young or maybe she's in her 20s, 30s?
So when somebody is unable to conceive, what we are trying to see is whether it's just a normal delay or whether there are any abnormalities that is contributing to this delay of getting pregnant. So when we are doing this workup, we might find that it's the endometriosis that it's causing. So in fact, like if you take the people who come for treatment of subfertility, almost 50% of them have this disease we call endometriosis, compared to general population, which is having only about 10%. So I think it's better now for us to tell a little bit about endometriosis and what it really is. Now, generally in periods, what happened is there is a lining within the womb, which we call the endometrium, that has the glands and the supporting structures which are developing with the hormones over a cycle, and then after the hormone effect goes off in the cycle, it breaks down and goes off as periods. In endometriosis, these cells which are in the lining of the womb, cells that are similar to that and glands that are similar to that are seen outside. So what I mean by that is the cells that are supposed to be within the womb itself are lying outside the womb. It can be somewhere just in the cavity of the tummy or the pelvic cavity, or it may be in the ovaries, or it may be somewhere in the tubes. And rarely some people might have them in bowels, then the urine tract, as I said, or else we have seen rare people who have these cells within their lungs or the brain. So basically now these endometrial glands and tissue that are outside the cavity, outside the endometrial cavity, are also hormone sensitive like the ones that are inside the cavity. So during the cycle, when the hormones go up and down, these outside endometrial cells also grows and regresses. So likewise, you think now internal cavity, when the hormone level goes down, there's break of these cells and it bleeds out. But if it is somewhere within the tummy or somewhere in a confined space, when the bleeding occurs, there's nowhere for it to go. So simply, that's how this pain comes. So because of that, there's a lot of irritation, inflammation that is causing all irritation around these nerves and nerve endings. So that will cause this pain.
So doctor, you have to diagnose obviously, know whether this is within, without, and to what extent. How do you get about this?
So that is depending on, basically one thing is depending on your symptoms. So if you consult a gynecologist and talk about this, then they would be able to find out whether the pain that is coming in the periods are within the normal limits or whether whether it's abnormal. So that is one way. And then they will also do an examination. In examination, we are able to find whether there are any obvious cysts and whether there is the normal movements of the internal organs of the body, and whether there is any thickening or any sort of nodules, what we call, around the pelvic cavity. So things like that can be elicited during a gynecological examination. And other than for that, transvaginal ultrasound scan, that is internal ultrasound scan performed by a good gynecologist, should be able to see most of the abnormal things. So basically ultrasound is a very good investigation where you can directly see most of the things within the pelvic cavity of a woman. So in that way we would be able to see any cysts that are developing or any nodules that are coming up because of endometriosis. Likewise, we should be able to diagnose. Rarely some people might need additional things like looking at the kidneys or the urine tract, or we might need to look at the lungs, or very, very rarely look at the brain, things like that. For that, there are additional investigations that we perform.
If necessary. If
necessary, yes.
Doctor, around what age would you actually detect this? You says that if, like, when you say, if a girl, attains puberty at age about 13, 14, 15, takes about 10 years to, in a world where this is a situation, in the general sense, where you can detect it. Now, having detected it after this period of time, so obviously, whoever it is, this young woman is in her 20s.
Yes.
And then from that point onwards, you have to now ensure that this is what is actually wrong with her through your tests.
Yes.
Now, having done that, what is the next step? You have to treat, of course, but you spoke of even that it will be difficult for them even to have sexual intercourse.
Yes.
So how does one go about addressing these issues? And also, would you have to even bring in another consultant into the picture if need be? It'll be like a multi-pronged approach to address the situation.
So basically, if we take, it's a very individualized treatment plan that different women will have. But if I'm to simplify things, so I would say I would basically divide these patients into majorly two groups. One would be coming for fertility issues. One would be coming with the pain problems. So, in a nutshell, if you have problems with fertility because of endometriosis, obviously we need to kind of try to give you medications to have a baby. One end of the spectrum is going for a thing like IVF, in vitro fertilization. Or else we can go for an operation, clear all these, whatever the abnormal endometriotic cells that are lying within the abnormal places, and completely make it back to the normal or the normal way, and then try to go for a natural conception. So that is in summary for somebody who is having problems with fertility. Somebody having problems with pain only. Suppose they have already children, or they are not married, or they are not planning to have children. In that sense, we can go for medical things like hormones, because as I said, these cells are responding to hormones. So we can basically suppress the level of the hormones in the body and control the disease. So that way we may be able to control it. Also, now somebody who's having kind of severe pain during intercourse may not respond to suppression of the disease by just hormones. We might need to take off these abnormal tissues as much as possible. For that, we kind of offer surgery. So some people might have just medical therapy, or some people might need surgical treatment. That depends on the patient's symptoms and also their future sort of plans. So just to elaborate a little bit, now surgical wise, what we offer nowadays is almost 100% is keyhole surgeries, that is laparoscopic surgeries, where you put a small camera into the abdominal cavity or inside the tummy. Then we try to magnify and look at all these cells and try to clear them off. So that is what we generally accepted way of doing surgery for endometriosis.
Will it be an issue if the patient is older, in their approximately like in their 30s? Because now most women, the trend is to have a late pregnancy. You have those who are pregnant in their 20s as well, but you find those are career oriented, or for whatever reason pregnancy gets put off till they're in their say mid 30s. So will that be an issue, age, if in the event they have these problems as well?
For fertility, age is always an issue, because younger the woman, there's higher chance of having a natural conception, that is a natural baby, without any complications. Older you are, you have less number of eggs in you, so there's less chance of having a baby, and also prone to a lot of other medical problems. So because of that, if we find a problem, especially in a kind of a older woman, then we try to go for more aggressive kind of treatment. That is what we do. We try to get them pregnant as soon as possible, rather than waiting for a long duration of time.
But that depends on the person who comes to see you at that point in time.
Yes.
If they have delayed coming, you have to deal with the situation at that point in time.
Yes.
Doctor, having said that now, is assuming that somebody has a normal sort of monthly cycle of periods, and then they can get pregnant. After having a baby, can such a situation occur in the system?
Yes. So as long as there are reproductive hormones that are acting on the body, this situation can occur. Just to say in short, we encounter a lot of women who have had cesarean sections coming with severe pain at the caesar scar site, where there is endometriomas or endometriosis deposits that are seen at the edges of the wound itself. So it's not a disease that just goes off after having a baby. Still, you are prone to get the same thing till you have your hormones going on.
So, doctor, what's your take-home message?
So basically, what I have to say is endometriosis is something very common. So 1 in 10 can have endometriosis, and that is also there is a problem because people are not very worried about the period pains and also these gynecological things. In all over the world, diagnosis of endometriosis tends to be very delayed. Average, it takes about 8 to 10 years in any country for it to be diagnosed because of the presentation issues. Nowadays, we have very good ways of treating. So because of that, we can, of course, treat the disease very well, suppress it, so that the woman almost can have a normal type, kind of a life compared with their colleagues.
Thank you, Doctor. There we end this interesting discussion on endometriosis and place on record our grateful thanks to Dr. Indunil Piyadigama, Senior Lecturer at the Department of Obstetrics and Gynecology, Faculty of Medicine, University of Colombo, and Dr. Piyadigama is also an honorary consultant gynecologist at the D'Souza Maternity Hospital in Colombo. Thank you so much, Doctor. Thank you also to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.